Ed Scott epitomizes the new kinds of partnerships. He's worked in many different fields, the private sector, government, the philanthropy. He describes himself as a serial think tank founder. His creations include the Center for Global Development and his support for DATA, which is the One campaign, which are remarkable organizations that have allowed some of Bono and others' genius to translate into the development world. He's also a Georgetown parent and has many other hats. But among the reasons why he is remarkable is that he leads philanthropists in the willingness to address the complex and messy issues of policy. And I think he stands out, among others, for that. Father Snyder has done many things over his life. He is currently the president of Catholic Charities, but he has also focused on humanitarian relief, on the Katrina and the Rita disasters. He is a leader in thinking about how to create a better world by the year 2020. And he also is one of the people who has been tapped to serve on the president's new Faith and Community Initiatives panel. So he is, again, a man of many talents. Reverend David Beckman is one of the few people that I know who is an ordained economist. He heads a remarkable organization, Bread for the World. He shares with me being an alumnus of the World Bank, where he helped to transform attitudes towards poverty and towards civil society. And he is a dedicated and passionate spokesman for everything that has to do with poor people, poor communities, and the potential that they have going forward. And finally, Cardinal McCarrick, who I think needs very little introduction here, is a remarkable example of the best in thinking about human rights, social justice, and I think he exemplifies blessed are the peacemakers. He spends much of his time now traveling the world. He's about to get in an airplane again to circle the globe, probably for the 30th time this year, going to hotspots all over in a search for peace, including in the Holy Land, in the Philippines, and in other places. He has a very long career. He served on the conclave that selected Pope Benedict XVI, but he has also served in many other capacities, both internationally and domestic. So I think we're very fortunate to have this group. I'm going to start by asking each person questions, and then we'll have some discussion within the panel and have time then for questions from all of you. So I'm going to start with Ed Scott. And Ed has created yet another think tank, a brand new organization, the Center for Interfaith Action on Global Poverty. And I wanted to ask you, what had inspired you to do this, and what do you see as the major gaps? I think one of the themes I know that Ed will mention, but I think it runs through all of this panel, is translating ideals into action. And the word action is prominent in this new organization. So Ed.
Well, thank you, Catherine. I think you're quite correct in focusing on the word action. With Dr. Obama not being here, I'm the only non-ordained member of your panel. And it's not ever likely to change. I did have to give a prayer in Nigeria recently, which was quite stunning. But in any event, we're all products of our own experience, and as you so generously pointed out, I've been involved in a number of development initiatives over the last 8 or 9 years, starting with the Center for Global Development, and I experienced the same thing you and David Beckman and experience at the World Bank, and that is that when people think about faith institutions and they think about development, they wonder why you're saying those things in the same breath. And sometimes when you mention the role of the faith community in development questions, you get a big eye roll from the development professionals. I had observed as I watched many of these development organizations function that they were not able to effectively do certain things because of their lack of direct acceptance in the community, or their lack of continuity in the community, their lack of understanding of local mores. And more I came to understand what the faith-based community was doing in terms of delivering real services, real action in the poor countries of the world. And for those of you who don't, spend your time focusing on this stuff, the numbers and the impact is really staggering. I mean, organizations like Catholic Relief Services and World Vision, are billion-dollar budgets. They're like a USAID all to themselves. And the number of them is quite extensive, and they represent all the religious traditions, from Dr. Albano's Islamic Relief and now the Humanitarian Network, to the American Jewish World Relief, to ADRA, the Adventists, to Compassion International, which is a broadly evangelical-based organization, all of whom are attacking the development question in a slightly different way. I happen to have some personal involvement with Compassion, which is a child development-focused organization, and I came to be aware of their concern for the fact that many of their children were dying of AIDS, and they didn't know quite what to do about it. And after working with them for a while, they mounted a very well thought out, well orchestrated testing and treatment program, which now they have deployed throughout most of East Africa and in one West African country, and they have tested nearly 500,000 children and caregivers, and are giving antiretroviral drugs to about 20,000. So they're filling these gaps that the government and the ministries of health aren't capable of filling. And why is that? Well, it's basically about money. I mean, if you look at Africa in general, which is, not where all the poverty is, but where probably half of it is in the world, you will see that 40% of the hospitals and the healthcare delivery is delivered by faith-based organizations. And that's denominational organizations like Lutheran hospitals, Roman Catholic hospitals, Islamic hospitals, and clinics. And in the more at-risk countries, the percentage goes up, so that in the Sudan, it's like 70% of the healthcare is delivered by faith-based institutions. And what's really curious is those institutions are not getting their fair share of the pie by any stretch of the imagination. I don't know how many of those you are familiar with the Global Fund, but there's this thing called the Global Fund to Fight AIDS, TB, and Malaria, which dispenses literally billions of dollars every year and to fight AIDS, TB, and malaria, and does an excellent job. And I am a very strong supporter of the Global Fund and have been right from the beginning. But in the early days, they did an assessment of how much of their money was going to faith institutions, who I just told you deliver about 40% of the African health care. Well, it's about 4%. It seemed to me that those numbers were a little bit out of sync. So a lot of us raised a fair amount of cane about this, and they did another count 2 years later, and we had done a terrific job. We got the number up to 6%. So you can see that there's a problem.